Hello, everyone. Welcome to our event on the integration of e-health innovation within healthcare systems in Europe. Very grateful to the Portuguese EU presidency for hosting this event in context of the eHealth Summit. We're most grateful for being here. My name is Philipp Beck. I'm the CEO of eHealth, and I have the pleasure of moderating this panel discussion today. I'm joined by Tamara Milagre. Tamara is the president of EVITA Cancro. It's a patient-led registry for hereditary cancer. Welcome, Tamara. We also have Alexandre Lourenço. He's a manager at CHU in Coimbra and also the president of the Portuguese Associations of Hospital Administrators. Welcome, Alexandre, and good to have you here. Then all the way to Germany, to Erlangen, Jörg Trinkwalter is with us. He's the CEO of Medical Valley. Welcome, Jörg. And finally, last and certainly not least, my friend Kurt Höller and colleague, who's the director of business creation at eHealth. So we'll try to make these next half hour exciting and insightful for all of you today. And we want to talk about eHealth and its super complex integration and uptake in healthcare systems. I think over these last now almost 18 months, the COVID-19 pandemic has certainly uncovered a number of vulnerabilities in our healthcare systems, but it also has unleashed, I would say, enormous creativity and progress. And I think while healthcare systems are left at risk, and they are, of course, also severely financially challenged, patients and citizens, as well as the entire sector, seem to be embracing the opportunities of new digital technology. So I think eHealth is certainly on the rise. And with that demand rising, patients want to be more engaged. I think the digitally native generation is also coming in amongst healthcare professionals today. And in many countries, we also see innovation in legislation. For example, in Germany, the regulatory landscape for digital health applications is changing, and Jörg will be able also to speak about that. And finally, and that should be, of course, the red thread here for our event, the EU is also driving significant change, for example, through initiatives like the European Health Data Space. So we want to explore a number of challenges around this topic, both on the technical side, but also a bit on the process and organizational side. We want to hear from our speakers about their practical experiences, and then want to look at what can we expect from the European Union, from the Commission potentially, to take initiatives in this area. So first, I would like to turn to you, Jörg, and share with us a little bit from your perspective some examples of key, maybe technical challenges that you have faced when supporting the adoption of new eHealth solutions in existing healthcare delivery systems. So Jörg, over to you. Let us know.
Thank you. Yeah, so from my perspective, it's really not only talking about technical technical problems, implementation hurdles. It's also about talking structural and processual hurdles and innovations, like you have mentioned in your introduction. And I will give you some examples, yeah, because if you do not integrate a digital health application in a healthcare provision delivery process, then you have really the problem that this is in general not reimbursed. And if you are a startup, for instance, you will not find an investor because if you do not generate revenues, it's hard for you to present your pitch deck to an investor. And we see this really here happening in Germany currently. I give you an example. We had 2-3 years ago, we had a so-called Fernbehandlungsverbot, which means it was prohibited to do treatments remotely. And so if you were a telehealth startup, for instance, it was really hard for you to create a business plan due to this law, due to this prohibition. And let's say 2 or 3 years two or 3 years ago, the current German administration came up with a new act, the Digitale Versorgungsgesetz. It's the Digital Care Act, and with this act, they also deleted this prohibition, and this led to an enormous mobilization. Yeah, and not only in Germany, because now you have really, let's say, the situation that with your digital health application you can face or you can access a good market here in Germany of more than 70 million public insured people with public payers, and this led to enormous mobilization. So just one example, we had an accelerator program last year, and we had 272 applications from digital health startups from 57 countries of the world. So this was not only because of our great marketing, it was because all of them now really see a market in Germany. And I think this is the key. It's not only about technical innovation, yeah, it's about structure and processual innovation in the healthcare system itself. And if we are able with these innovations to create a market, then technical innovation will happen.
Thank you, Jörg. This is very impressive. What's coming up there? Alexandre, turning to you, you're in charge of managing a hospital, supporting the management of hospitals. You're probably a bit more at the receiving end also of this when it comes to also interacting maybe with startups that are advancing new tools. So hospitals are complex, busy places, lots of workflows, lots of legacy systems, cost pressures. What has been your experience of the challenges when it comes to integrating new eHealth solutions in Portugal, in the institutions that you work with, that would serve patients essentially?
Thank you, and Philipp, for the question. Actually, what we see is that healthcare has a tendency to status quo, and it's quite conservative to accept new ways of providing care. It's not only technology. It has a reason, mostly because we are dealing with patients, so we are careful in introducing new technologies. But what we know at this point is that eHealth will be a way of providing care. This can be understood as something like a threat to the current system. And hospitals and most of healthcare providers, the traditional healthcare providers, they can resist the introduction of the technology. What we can have is actually strategies to allow to boost this kind of introduction. And in that sense, what Jörg was mentioning, the ways of dealing or creating a retail market, ways of reducing fragmentation, ways of reducing regulations, ways of providing reimbursement strategies, they are ways to boost the introduction of technologies. And what we know actually is that we really need to train, to educate most of our organizations in dealing in a new way of providing care, in introducing this kind of technologies. And I totally believe that we are going to change the way that we provide care, much more closer to the person, much more centered to the patient. And that needs, we need to reinvent the way that we think the system. What we see is that, and empirical data, what shows us is that when we develop reimbursement strategies, as I was mentioning, when we deregulate, we have better tools that will be tested. What I try to believe, and eHealth is one of the partners that actually is driving the change of healthcare system across Europe, this kind of strategies at the national and local level, and what Jörg was also saying, will allow us really to introduce technologies. Even in my personal hospital, what we see is that actually patients and healthcare professionals are eager to introduce these kind of technologies. remote monitoring, remote rehabilitation. They are something that they want to use, even though, again, they feel that is threatened. They are threatened to this change, and the system will always try to resist to this introduction, and it's up to us to change this.
Thank you so much, Alexandre, for these reflections. So we have a bit system, let's say, resilience and maybe hesitation to change. At the same time, these enormous opportunities, and also, if I hear you right, maybe an opportunity to more forcefully move towards patient centricity that could be enabled through these tools. So Tamara, I want to bring you into the discussion. You are very much focused on a particular patient group, cancer patients. So there has been a lot of uptake now. More telemedicine solutions have seen implementation. How well do you feel this has served the patients that you are that you have in your focus, cancer patients? What are major challenges, maybe also particularly for this group? Share a few impressions with us.
Yeah, thank you. First of all, I would like to thank eHealth Portugal for this invitation to give the voice to a patient organization. EVITA is supporting families affected by hereditary cancer syndromes. The most famous case for sure is Angelina Jolie. So you inherit a gene copy that is has a certain defect, and that raises dramatically your risk to get a certain kind of cancer. Around 10% of all cancers are hereditary cancers. So we are talking about a lot of cancers. And so imagine we are here now remotely because of pandemic situation. So as you can imagine, when we had the real hardcore lockdowns, those people with this very high risk to develop cancer, they sat at home and nobody would check on them because they are not urgent medical acts. So we already before COVID thought that we would need some digital tool, some technological aid to support better those people that have genetic mutations and this very high risk for cancer. We are very preventive, as you understand, but unfortunately we have a lot of sick people already. The problem is they are mostly young adults. It's an early onset of disease. So if you have those gene carriers identified, you need to check on them every 6 months if everything is okay. And there are also preventative surgeries, just to understand what we are talking about. So we wanted to, first of all, we don't have any data on hereditary cancer. Saying that means if we do not have data, we cannot learn anything and we won't develop anything. And we urgently need to develop and progress in the science around hereditary cancer. Once again, 10% of all cancers, super expensive cancer because it hits on young adults. So we need to do something about that. And so we understood we need to create those data. In Portugal, our national cancer registry doesn't discriminate hereditary from sporadic cancer. So if we do not have any numbers, any facts to show our decision makers and payers that we need to allocate more money to this kind of cancer because it weighs as much as sporadic because it's so expensive. Once again, if we do not have these numbers, we do not have any argument. We talk about more or less 10%, but we need facts. So our registry doesn't discriminate this. They told us it wouldn't be possible because it's genetic information. So we thought from the patient side, if they don't do it, we need to generate patient-generated data. We need some data that do not exist and that help us to learn more and better. And then we started to plan the structure of a patient registry that is from people for people, and it's basically a platform where you register and you have an initial questionnaire with 3 questions: who had at which age, what kind of cancer diagnosis on the maternal side, on the paternal side. And with those very few questions, we can already identify people that possibly could be at high risk. Now I shut up. There are much more functions, but maybe later more about that.
Tamara, thank you so much. And actually, I would maybe like to follow up immediately on this, because if we now take sort of for the second half of our discussion, a bit more sort of the European perspective, and also what we think maybe we should be doing more in Europe. Do you see opportunities there in terms of linking potentially these kind of national registries as you are building it at European level? What's already done? What more could be necessary there? I think also the European Union is looking into advancing European health data space. I think we should facilitate also the connection of such nationally developed data resources or registries. Maybe with a request for a brief answer, what would be your main wishes here to Europe?
This is still for me?
This is for you. Yes.
Thank you. So, of course, it's a big wish that we extend this kind of registries and platforms to European level. That is the idea behind it. In a further phase, we will translate the platform in several languages, and we want to extend it more and more. More data, better. So, of course, this will be done. We have the technology for safe data, for anonymizing data. This technology exists and it's doable. So let's do it, because we don't have time to lose more and more to conversations and talking about patient-centered, and it's not really translated into the practice. We are kind of tired of speaking so much about patient-centered and not seeing it anywhere. So we need to pass to the practice, and like this famous architect, Mies van der Rohe, less is more. Let's talk less, just do more, just do it. We had already so many conferences and discussions. Alexandre knows perfectly what I'm talking about. We have so great experts with fantastic conclusions, but I don't see it in the practice. So I'm really not interested anymore in this kind of discussions. We just pass and do it. And yes, please do it on the European level, because this will be a huge step forward to knowledge and development. No doubt about that.
Thank you so much and for this really passionate call to action. Jörg, I will move to you, because you are working with the people that want to hear this kind of calls for action, and the people that want to get moving and also deliver solutions, and not only locally, but I think also to Europe as a whole. So coming a bit back to the startup world, those that hopefully can also utilize these kind of data to look for the provision of innovative solutions. What are your experiences, but also what are a bit your wishes, your perspectives? How do we create a European space, maybe a less fragmented European market for the kind of applications that we're needing? What are your views?
Yeah, so my view is that, let's say, I would, again, coming back to not only focusing on technical interoperability, I would also go for structural and processual interoperability. What does it mean? It means if you would like to develop a medical app or a medical device to the market, you then have to go for a CE mark. So if you have a CE mark, you're allowed to sell your solution in the European Union. But this, let's say, leads not to the fact that you can introduce your product to the healthcare systems in Europe you have then to go one by one. You have to do a market access one by one, every European country. And this is really, really time consuming. This is very costly. Yeah. And this leads to the fact that the best solutions possible are not finding a quick way to the market to the European citizens. Yeah. And it's also combined, let's say, with a lot of other disadvantages. Yeah. So if you're talking to investors, for instance, if you're a startup talking to investors, then you have to say, okay, I now address the German market, and then I have to go 2 years in a pilot study in order to go to the French market, and so on and so on. So what I would be very curious about is, can we establish a system, yeah, where I show in one country, for instance, Germany, if you want to become a digital health application in Germany, you have to conduct a study for 1 year. And with this study, you have to show positive healthcare effects. So if I show this positive healthcare effects in this study, yeah, which is just as a side remark, which has to be approved by the BfArM, which is the federal body for the federal authority for such studies. Can I use this data in order to generate an automatic or a fast market access also in France, in Spain, in Portugal, in Italy, wherever in Europe? If we would achieve this, I think this would be a really great thing, because then we would really have an accelerator for digital health applications, which are really serving the European citizens and patients. This would be my major thing.
Thank you so much, Jörg. So, Alexander, coming back to you. So now we've heard a big call for better data exchange, integration to accelerate research, but also improve care. So from the patient side, Jörg says, well, we need almost a fast track accelerator for digital health at European level. From the hospital side, you might even be a bit of a catalyst sitting there in between. You take care of a lot of patients. You do care, you do research. You're certainly also somewhere in there as a potential customer of some of these applications, at least. What are your calls to Europe, so to say? What is needed to support hospitals in this journey? What kind of EU level guidance would you potentially need? Share some thoughts with us on this, please.
Actually, in Philipp, this is much more than hospitals. This is about our health. And actually, with digital tools, we have the opportunity to reinvent the health system. Not only healthcare, but mostly to have this opportunity to really invest in prevention. What Tamara was saying is, for example, about predicting tools, is to allowing us to predict the risks to get ill, is allowing us to change the way that we behave, that we get healthy habits, and that we remain healthy. So this is about also each of us, and also about economic growth and happiness. So what we, or the call to action mostly, is to really look at this as an opportunity for Europe to have a real market of healthcare and to change the way that we provide care, investing really on people. This is not a trend. This is not a silo. This should be a common policy for all member states. And we really can do something about it. What we saw during the pandemic is that we continue to have gaps on healthcare. They increased actually during the pandemic. We continue to have inequalities in Europe, in each country, in each region. We continue to see this silo policy for healthcare and social care. We mistreat our aged population. We saw this during the pandemic. We continue to see it. and we really need to change. And digital tools can allow us to get this leapfrog on the system. And the Commission should realize that this is a unique opportunity to be in front of everything. This is not only health in all policies. This is health as a really European policy. And we have this opportunity if we invest commonly. During the pandemic, I supported the Commission in deploying artificial intelligence. In the beginning, we have the problems in diagnosing COVID. You remember the time to get a diagnosis, it was 4 hours in an hospital. And I helped the Commission in deploying artificial intelligence tools for CT scans, just to identify if it is COVID or other respiratory disease. We deployed it in individual hospitals. We needed to have a contract for each hospital. You can imagine in Romanian, in Italian, in Swedish, in Portuguese. It's absurd. Actually, we are currently deploying disinfection robots across Europe also, and it's the same. It's crazy if you see the transition costs that all of this has. It's absurd. We really need to break down these chains and really allow that these amazing guys that every day I listen, startups, academia, we need to create ways of them to come to the markets. And again, this is not only about hospitals. This is much more than healthcare. This is about us.
Thank you, Alexandre. Very clear, clear call to action. Good. We want to hear some of your reflections, and then we will wrap up. Let's go for it. 4 minutes.
Thank you, Jan-Philipp. Thank you. So we heard two things mainly. I think one thing is the need to support patient-centric innovation. That was made very clear by Tamara and Alexandre. And Jörg was putting high emphasis on the legal framework, the legislative framework that we need to move forward. And let me reflect how EIT Health also contributes to that and addresses these points. So first, EIT Health is of course very, very active in driving innovation through startups. 2020 has been an extremely successful year with more than 500 startups that we have supported, and they have raised more than 300 million euro, actually more than 350 million euro in this 1 year. And we have supported many startups in 2 areas. One is the patient innovation bootcamp, for example. So that's a bootcamp where we together with patients develop new methodologies, products, and services. This is a project actually run by Scandinavian and Portuguese partners. So that also shows you that we support startups right from the start to think internationally. So not to think only local or regional, but really think international. And a second project or a second topic I would like to outline is our education programs and also other competitions that we use to also highlight patient involvement. One example there could be our MedTech Live, where we're one of the winners, or basically the winner was a company, Apoio, that developed an amazing tool, a prosthetics instrument, prosthetics for legs, that can be easily adapted even in developing countries where patients that never had access to care could get that. And that's a clear example how a startup can make a real business case because they have already solved thousands of these prosthetics. So it's not a big player, but they have together with patients and developed that and are already active on the market and are now successfully fundraising to grow and get better. The second point I would like to address is the health data space. So we have heard especially from Jörg, how important it is to get better coverage and better alignment across Europe. And we have many very active partners in that space and that domain that have basically 2 insights. One, they are suffering from things that they cannot do so far due to data protection, for example. And on the other hand, they are already doing something that is very positively received, and where they are afraid that maybe in the future they might be prohibited to do that. And we have to collect both insights to frame the new European health data space and make sure that the success stories that we are developing now are able to flourish in the future. I'd like to close with two reflections. One is the COVID-19 pandemic has really increased the sensitivity for the importance of health. And I think European citizens have been always a bit hesitant with regards to data protection, and politics is doing the same. And the COVID-19 pandemic has now shown that we really have to develop new mechanisms in order to tackle this type of threats, and removing some barriers that are active in that space. And I think it's the right time now to use data to be more efficient, to be more powerful. And the challenge is now to make sure that the data are not only collected from patients, but that we also involve the patients so that they feel their data is used to provide solutions for them. I think that has been very clear from everything that Tamara, Alexandre, and Jörg have said. And the second thing, I just would like to repeat the quote from Tamara, and it fits very well because eHealth central office is positioned at Mies van der Rohe Straße in Munich. And you quoted Mies van der Rohe, that less is more. And indeed, we should not try to now create thousands of initiatives. I think that we have to make sure that those big initiatives that we are starting are really addressing and solving the topics and issues that we have. And that's reimbursement, regulatory affairs, and the right data to train our algorithms, to train our AI, and make sure that they solve the patient's needs. With that, thank you. Yeah, Philipp, back to you.
Thank you so much, Kurt. Left for me after these great insights provided by all of you is just trying to wrap up, and I'll do that very quickly because Tamara, as you also told us, we should spend much less time talking and more time doing things. So this is what we all should continue doing after this wonderful event is over. Few thoughts to conclude. So I think a clear call now to reinvent and reimagine our healthcare systems a bit through digital, and to make that step to move from sick care to healthcare, move towards better prevention and prediction, and also invest in that for the better of all of our health. I think to make that possible became very clear that there is shouldn't be just an opportunity or a possibility, but an actual obligation to share the data that we have all invested in obtaining, make use of this responsibly, of course, as an asset to help patients and to support this paradigm shift in healthcare towards more prevention, prediction, and of course, better care and better outcomes for patients. So I think then turning to Europe, and we are all part of it, the calls to action would be to really realize now that this is a unique opportunity to embrace health as a key policy area, to make it right front and center of the agenda. At least I think from our event here, I would judge that the community of innovators, of healthcare workers and managers, of patients and investors is certainly also ready for that step, and that would be a significant evolution at European level. And there's of course also an opportunity now for Europe to create a real market. So Alexandre, you clearly said there's also there's an economic opportunity in this, and I believe that there's an opportunity, of course, then to also become and to maybe remain the place where innovations are shaped and developed that we then also want to use, and not only to buy them from other places in the world. And I think for sensitive areas that are so dear to all of us, like health, we should be an important player in this market in order to be innovation shapers rather than only takers. And for this, I think that was also very clear from your points, Jörg. We need to defragment the market. We should try to create a fast-track market access system for digital health, and maybe the learnings, recent learnings from some of the member states can be a blueprint here, and see that we fast-track and maybe build a fast track that would actually set us apart globally and make Europe an attractive market for digital health applications and a manageable market. So let's get moving. Less is more. Good regulation is not the only thing that you can bring to a party. You also need creative ideas. You need more than good regulation, but I believe it will be a good thing now to start with. So hopefully this event could get some good thinking going on this presidency's agenda. And I'm left to thank all of you who have joined me here today, Tamara, Alexandre, Jörg, and Kurt, of course. Thank you very much for being here with me today and making this event a really great and insightful conversation. Thank you very much. And here we close.